Equipoise or Boldenone, the anabolic steroid that was developed to enhance the performance of horses in races, and yet it became one of the most widely used anabolic steroid in bodybuilding history. On paper, it seems like a simple drug to understand, but in reality, it is quite a weird one, as its effects on the body are pretty unique, and it remains one of the most controversial steroids among bodybuilders. Some absolutely love it, while others hate it. So, in this video, we are going to break down everything about Equipoise. We will dive into its history, medical uses, and unique properties. Additionally, we'll explore its role in bodybuilding, including dosages, benefits, potential side effects, and what you can expect when using it. We will also talk about its effects on the kidneys and its relation to anxiety, and whether it is a good or bad option for people who are doing PCT. And of course, when and in which phases should be used. So, if you are a bodybuilder, an athlete, or just curious about Equipoise, this video will cover everything you need to know about it. And now, let's start with the history and medical usage of Equipoise. Equipoise, also known as EQ, is the brand name, while the chemical or generic name is Boldenone Undecylenate. Undecylenate is just the name of the ester attached to boldenone, and the ester simply determines how fast the drug exerts its actions in the body and the half-life of the compound. This ester has a very, very long half-life, which is about 14 days. Ciba, the pharmaceutical company, developed boldenone in 1949. Then, in the 50s and 60s, they experimented with several esters and finally released the undecylenate ester. The drug was first sold under the brand name called Parenabol. Parenabol was used for a very short period in the human market during the late 60s and early 70s. It was prescribed to treat medical conditions like muscle wasting and osteoporosis. However, after that, its use in humans was discontinued. Then, the pharmaceutical company Skip introduced the drug in the animal market under the brand name we know today, Equipoise. Equipoise is used on several animals. However, its most common application is on horses. It is used to increase lean body mass and stimulate appetite in animals. Today, the pharmaceutical company Pfizer is producing Equipoise for the animal market, along with other generic brands. And of course, it is also produced by the illegal underground labs for human use. And now, let's talk about the structure and characteristics of Equipoise. Equipoise is derived from the hormone testosterone, and surprisingly, its chemical structure is very similar to the anabol. However, they act completely in a different way in the body, and they will give you completely different results. Equipoise is well known for its steady, high-quality lean muscle gains, while the anabol is famous for rapid size gains combined with high water retention and a watery look. The androgenic anabolic ratio of Equipoise is 50 androgenic and 100 anabolic. I will explain this in a second. The androgenic effects are related to male characteristics. Things like deepening of the voice, increased body and facial hair, oily skin and acne, or even aggression. On the other hand, the anabolic properties are the effects that support muscle and tissue growth. These include increasing muscle mass by boosting muscle protein synthesis, improving bone density, and helping the body recover faster from workouts or injuries. All anabolic androgenic steroids have both anabolic and androgenic properties, but the ratio varies with each compound. This ratio is always compared to testosterone, which has a baseline ratio of 100 to 100. This is exactly why anabolic steroids were created, to increase the anabolic effects while reducing the androgenic effects to minimize the side effects. However, remember that the anabolic androgenic ratio comes from lab experiments on rats, which don't always translate perfectly in the real world. This is why I consider the anabolic androgenic ratio to be just a guideline, and I don't take it very seriously. And now, let's discuss the side effects of Equipoise. Equipoise is classified as an anabolic steroid. However, its androgenic side effects are still very common, especially at high doses. These side effects include increased oily skin and acne, increased body hair growth, and accelerated hair loss. So, I don't see Equipoise a suitable choice for women because the risk of virilization symptoms is extremely high. And here is the problem. If a female starts experiencing these side effects and stop the drug will take a long time to clear out of the body. And at that point, the damage has already been done and become irreversible. The 5-alpha reductase enzyme, which can be found in high amounts in the skin, scalp, and prostate, is the enzyme that converts testosterone into dihydrotestosterone. When it interacts with boldenone, it converts it into a more potent androgen called dihydroboldenone. And taking a 5-alpha reductase inhibitor like finasteride won't do much to reduce its androgenic side effects, like hair loss. Now, when it comes to estrogen-related side effects, Equipoise is a pretty weird drug. In the past, it was believed that Equipoise aromatases into estradiol at a 50% rate. You can even find this claim in medical books like Anabolics by William Llewellyn, which, by the way, is a great book, and I often use it as a reference for the history and basic information about these drugs when I make these videos. However, it turns out that this information is not accurate. There are many anecdotal reports that shows Equipoise actually lower estradiol levels, and it increases another type of estrogen called estrone. I have seen this in my own blood work when I used Equipoise in the past, and it happens every time when I use it with one of my clients. I also have to mention its effects on lowering estradiol levels are not predictable. It can really crush your estradiol levels, or it might just have a slight impact. That is something you have to figure out yourself when using Equipoise by monitoring your blood work. But from my experience and what I have seen, in most situations, it will lower estradiol significantly. So, probably adding boldenone to a cycle could help control estradiol levels without the need for aromatase inhibitors. This can also apply to primbolone. Regarding the effect of Equipoise on the kidneys, in recent years, Equipoise has gained a reputation for being toxic to the kidneys. This mainly comes from the studies on animals. However, there are not enough studies on humans that confirm EQ is more toxic to the kidneys than other anabolic androgenic steroids. But at the same time, we also don't have enough evidence to say the opposite. So, regular blood work and monitoring kidney function when using EQ is highly recommended. Or, if you are concerned about kidney health in the long run and want to play it safe, you might consider avoiding EQ and replacing it with a DHD derivative instead. Regards cardiovascular side effects, all anabolic androgenic steroids, especially orals, have a significant negative impact on cholesterol levels. These compounds tend to decrease HDL, which is known as the good cholesterol, and increase LDL, which is known as the bad cholesterol. This shift in the HDL to LDL ratio can increase the risk of cardiovascular diseases. Equipoise, like all other anabolic androgenic steroids, will impact cholesterol levels. Also, Equipoise is well known for increasing red blood cell count and hematocrit, which leads to thicker blood, and that puts more strain on the heart while pumping the blood. But I have to mention, all anabolic androgenic steroids will do this to some extent. I find people tend to exaggerate this effect when it comes to Equipoise. For some reason, many people believe that only EQ does this. Maybe because people tend to use Equipoise at higher doses compared to other anabolic androgenic steroids. So, the increase in red blood cells might be coming more from the total anabolic load used rather than from Equipoise itself. But it is still something to consider when using EQ. Before we move on to the next point, which is the effect of Equipoise on mental health, I have to mention something very important. YouTube doesn't like to promote this type of content. So, if you found value in this video, let me encourage you to like the video, subscribe to the channel, and hit the notification bell so you get notified when I upload the next videos. That way, you will not miss out the next videos. And now, let's talk about the mental health and sense of well-being when using EQ. Generally, EQ is not one of the steroids that will make you feel better mentally when using it. At best, you might feel the same, but many users report extreme anxiety when using EQ, which I have personally experienced in the past when I tried EQ for the first and last time I have ever used. Some people also report depression while using it. Now, some argue that this anxiety issue comes from crashed estrogen levels, which could be true. But with EQ, I really don't think it is just about estrogen. I believe that EQ affects the brain chemistry directly. I remember my estradiol levels were around 33 or 35 when I used it, which is right in the mid-range. So, this is something you really need to consider before using EQ. The biggest problem is that if you do experience these side effects, it will take a long time to recover because EQ has a very, very, very long half-life. I personally remember spending about 2 months dealing with anxiety until I finally started to feel normal again. Even though I am normally a very calm and a chilled person, and you can maybe see that in my videos, EQ was a very bad experience for me mentally. That being said, some people never experience these mental side effects. I had even clients who actually liked EQ a lot. And now, I want to hear from you. Tell me about your personal experience with EQ in the comment section below. Was it a good or bad experience, and did you experience anxiety from it? And now, let's go to Equipoise and testosterone suppression. Equipoise will suppress your natural testosterone production. Therefore, testosterone should always be used alongside EQ in any cycle, as testosterone is the primary hormone that your body relies on for proper function. And when it is suppressed, it affects the production of other important hormones, like estrogen and DHT. These hormones are very important for the body to function properly, as they also play a big role in muscle building process. By suppressing your natural testosterone production, you will experience lower levels of estrogen, and as a result, you will not get the most out of your cycle, and you might experience low estrogen side effects, things like low libido, anxiety, or joint pain. Therefore, testosterone should always be the base for any cycle. Also, I have to mention this, for people who are not on TRT and they plan to do PCT after their cycles, using EQ might not be a good idea because of its long half-life. If you do PCT, you should generally keep your cycle duration shorter. But if you really want to get results from Equipoise, you need to run it for long periods, at least 16 weeks, but ideally 20 weeks or more. The biggest issue is that even when you stop injecting EQ, it takes a very long time to fully clear out of your system. So it continues suppressing your HPTA axis for an extended period, which means your cycle technically lasts longer than you think, and your recovery will be delayed. For example, you might stop using EQ today, but in reality, you are still on a cycle for the next 2 months. Of course, this depends on the dosage you are using. The higher the dose, the longer it takes for the drug to clear your system, and the longer you stay on cycle, the harder and longer your natural testosterone recovery will be. Therefore, I would recommend avoiding Equipoise if you are doing PCT. Let's talk now about Equipoise dosages among athletes and how they use it. As we mentioned, EQ is not approved for human use. Therefore, there are no official prescription doses for medical conditions. For athletes, the most common dose starts at 400 milligrams per week and go up to 800 milligrams per week. Of course, some people push it up to a gram or even a gram and a half, but we are only talking about the most common dosages here. Because of the long half-life of EQ, in my opinion, running it for anything less than 16 weeks doesn't make sense. I would even prefer longer cycles like 20 weeks or more. Some users like to front-load EQ at the beginning of their cycle. This means doubling the dose for the first 1 or 2 weeks to reach peak levels faster. Since EQ has a long half-life, this in theory makes sense, but I am not a fan of this practice because that can cause significant side effects at the beginning of the cycle. EQ is also very versatile. It can be used during a lean bulk to add steady gains of lean muscle tissue, and it can be used in cutting cycles. So now, why do some athletes love Equipoise while others hate it? Equipoise is one of the most commonly used anabolic androgenic steroids among professional bodybuilders, and there are several reasons for that. It has many pros, such as it is cheap, it is easy to get and less likely to be faked, it helps add lean muscle tissue, so it can be used in both off-season and cutting phases. It is a mild compound with fewer side effects compared to other anabolic androgenic steroids. It may increase appetite, which can be very beneficial in the off-season when calorie intake is high. However, not everyone experiences this benefit, and the reasons why some users hate it because it is not approved for human use. Also, it has a potential risk in theory for kidney health in the long run, but we have already discussed this topic. Many report extreme anxiety and feeling mentally bad while using it. Also, some don't see it as a great muscle builder and feel it doesn't bring anything special to the table, preferring DECA over EQ in the off-season, or even Mastron or Primobolan, which are approved for human use and might be much safer compounds in the long run. Also, it has an extremely long half-life, so if you experience side effects, you will suffer for a very long time even after stopping it, and it requires a lot of patience to see results, which may not suit everyone. So now, you understand the pros and cons of Equipoise, and you know why it might be a good or bad option, depending on your goals and individual response. And now, let's move to the availability and supply of Equipoise. Today, the pharmaceutical company Pfizer is producing Equipoise for the animal market, along with other generic brands. And of course, it is also produced by the illegal underground labs for human use. It is available only in injectable form, and it is commonly dosed at 200 milligrams, 250 milligrams, or 300 milligrams per milliliter. You will find it under different brand names in the market, such as Boldenone, Boldenone, Boldenone. These are just brand names, but the compound itself remains the same, Boldenone Undecylenate. If you found value in this video, please give it a like, subscribe to the channel, and hit the notification bell so you don't miss the upcoming videos. For online coaching and consultations, please check out my website. I will leave the link in the description below. Thanks for watching and see you in the next video.